Hello everybody, Suzanne with Dawning Visions Hypnosis. Question for today is, do you really have what it takes to lead a person to health? In this case, mental health, but it could also be physical health if they are having somaticized pain, as a few of my clients have had over the years with migraines and rashes especially. This is an important question because our clients and patients come to us in order to resolve their problems. And in order to do that, we have to know who we are, what we stand for as a professional, and how to interact with the client or patient in a way that works for them and for us. And not all mental health professionals are capable of doing that. And I know that from many of the questions that are in CORE, a forum where people can ask questions and other people can answer questions, where people are wondering where they can find a decent therapist or why it's so hard to find a good therapist, or others who have complained bitterly about their experiences that they had with therapists. Now, of course, I'm not in the sessions with these people. However, there are some legitimate complaints in terms of what is not happening. And I can tell you that one of the people on there who answers a lot is a retired psychologist. And he's really clear with everybody on there that there is a problem with both quality control in terms of who's allowed in the programs, as well as the supervision that may or may not be happening as people are both being trained, as well as when they're in the field. That's a PhD psychologist, not me saying that. So what do you do about it? Well, part of it is that we have to know that our lives are together for the most part, that we are happy and contented and are able to be a real source of, shall I say, open listening and being able to assess what is truly going on for the patient or the client and being able to give them our best assessment as to what needs to happen, and then giving them the tools and techniques they need in order to grow beyond it. It's not a matter of saying, poor you, poor you. It's a matter of validating feelings and then letting them learn how to forgive others who they felt harmed by and taking responsibility for their own part in whatever may have happened. Because some people make decisions like leaving abusive relationships, usually for their kids. I've worked with several women over the years who were in those situations, and in some cases they didn't even realize that they were dealing with abusive relationships until I pointed out to them that if they're no longer allowed to see their family or their friends, that is a form of abuse. So we need to be able to understand what's going on with them and give them what they need in order to heal and move forward in their lives. Now, one of the issues that I found when I was working in conventional mental health was that it was always about pathologies and endless sessions in too many cases because of the diagnosis given, as well as medication. This is a problem. This is a problem that I actually heard about from other people whose videos I watched in order to get content for this series, who were really upset that they were supposed to refer their patients to a psychiatrist for medication. Because in some cases this is not necessary. It's like an upsell. It's like ridiculous. So I found that the world of hypnotism and neuro-linguistic programming was all based on helping our clients heal, to have an open space for that to happen, and to give them the tools and techniques, along with our facilitated work, with those tools and techniques to help them to actually heal and move on. And it works. It works brilliantly. So if you're interested in learning how to do that, I do offer a 2-day VIP program. You can do it on a Saturday and a Sunday. And it's all done online, one-on-one. And I include a 12-month mentorship so that you can actually learn how to apply the tools and techniques that you learn to the patients as you're working with them. Trust me, this is the only way I learned how to get really efficient at what I do with my clients. I was calling my trainer's office like every week when I was first learning how to do this because it was included in both my neuro-linguistic programming practitioner program and my neuro-linguistic programming master practitioner program. I don't know of any training folks in hypnosis or neuro-linguistic programming who offer this these days. So if you're interested in learning more, I will have my contact information in the description box below. So I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye all.